Hi, I'm Dr. Suneet Mittal, Director of the Cardiovascular Service Line for the Valley Health System. We have a large team of experts within the cardiovascular service line that includes non-invasive cardiologists, interventional cardiologists, structural cardiologists, heart surgeons, heart failure specialists, and electrophysiologists. By taking advantage of this team of experts, we're able to really deliver the best care possible to our cardiology patients. At Valley Hospital, we've invested not only in people, but the facilities and the technology to ensure that patients are really getting the latest evidence-based therapies that are possible. And I believe that there is very few things that are being done in cardiology today, nationally, that are not offered at Valley Hospital. Here, we've housed all of our cardiac specialists on one location. So we have the advantage of being able to walk next door and ask our colleagues, hey, what should we be doing for this patient? Do you think you or your service can help, work with us to optimize the care of this patient? And it gives something to patients that is not otherwise possible in typical cardiology practices. In surgery, we're very fortunate to have an expert in aortic valve surgery as well as aortic root surgery. This is very uncommon in most cardiovascular programs. We have an expert who does surgery on patients with hypertrophic cardiomyopathy. We have an internationally renowned expert in the world of TAVR, or percutaneous aortic valve replacements. We have recently opened a new program for renal denervation in patients with drug-refractory high blood pressure. We now have a team-based approach to the care of patients with pulmonary embolism. In the world of electrophysiology, we were one of the first to incorporate pulse field ablation for the treatment of atrial fibrillation. We've incorporated some novel augmented reality systems to help with real-time imaging in the electrophysiology laboratory. One of my colleagues has started a radiation therapy program for the treatment of patients with ventricular tachycardia. And these are just some of the examples that I can give you of some of the innovations that are occurring daily at Valley Hospital. We have a really fabulous team of people that are dedicated to research in cardiology itself, which has really allowed us to bring some very innovative research trials to Valley. And thankfully, we've translated that into many opportunities for presentations at national meetings, both for attendings as well as our allied health professionals, and many, many publications in high-impact peer-reviewed journals. Our long-term goals for the service line are to ensure that we continue to innovate, that we make services as easily as possible to basically get, because if a patient can't access the services, what's the point of having them? From the time that the patient seeks their appointment, we want to make their journey, which can be a scary one, as seamless as possible and as positive as possible. So we help them secure these appointments, we help them get through their testing in a timely manner, and armed with a number of attendings and allied professionals, we try to give them the most customized care possible for a patient with cardiac disorders. We have a very strong commitment to quality. We measure it. It's in our core DNA. We're constantly looking for ways to improve that. And I think that is a very big deal, which separates us from other centers. And so patients should really feel that not only are they going to get great care here, that it will be really high quality care.